Hello, I am Nima Mohammed, a public health nurse with Ottawa Public Health. Many parents feel anxious about the risk of COVID-19 in schools. We wanted to explain the process that Ottawa Public Health and schools use to notify parents when a student has tested positive for COVID-19. In this video, we hope to clarify some of your concerns by explaining the steps that happen when a student becomes sick while at school or confirmed to have tested positive for COVID-19. If a student or teacher identifies that a student is unwell with symptoms similar to COVID-19 while at school, then as a precaution, that student is separated from their classmates and other children and taken to a designated room where a school staff member will stay with them. The school will then contact you and ask that you pick up your child as soon as possible. As a precaution, siblings of other household members who attend the same school or another school will be required to go home and self-isolate. When you arrive at the school to pick up your child, you will be given a letter from Ottawa Public Health that provides you with information on what steps to take next. This letter will go over things like isolation requirements, testing of the child who is not feeling well, and the rest of the members of your household. The next steps depend on the type of symptoms and number of symptoms that your child is experiencing. This is where it can get a bit confusing. If your child has one symptom of fever, chills, new cough, shortness of breath, or loss of taste or smell, or any two symptoms of a sore throat, stuffy or runny nose, headache, nausea, vomiting, or diarrhea, then Ottawa Public Health advises that you take your child for COVID-19 testing at a COVID-19 testing center or care clinic as soon as possible. Your child must remain in isolation at home while waiting for the results of a COVID-19 test and cannot attend school in person. Siblings and other people living in the same household are also required to isolate at home while waiting for your child's results. So, what happens if your child or any child at school receives a positive COVID-19 result? Ottawa Public Health will be notified of the positive result by the lab. The time from when the individual finds out that they have tested positive and when Ottawa Public Health is notified is usually about 1 day, but sometimes takes longer. Sometimes the school principal is informed of a positive test result by a parent or staff. Then Ottawa Public Health works to confirm the positive result, and the nurse begins to work with the school principal to determine the risks and contacts. Ottawa Public Health's goal is to reach all high-risk contacts in schools as soon as possible. But there are some important steps that must happen before notifications are sent. First, we ensure that the individual with a lab-confirmed diagnosis of COVID-19 is not attending school. As a result of having gone for testing, the person who is confirmed positive should be self-isolating at home, reducing any further transmission from this person within the school. Next, we contact the school to make sure they are aware that a student at the school has tested positive and work with them to identify any high-risk contacts of that student. This part of the investigation involves gathering the details of the individual who has tested positive, such as what grade they are in, if they have symptoms, and when did they begin, when were they last at school, if the student takes the bus, and if they attend any before or after school programming. This information is used to determine who in the school is considered a high-risk contact. The information gathering to identify high-risk contacts can sometimes take a full day depending on when the lab report reaches OPH. To prevent notifying someone that they are a high-risk contact by mistake and minimize the stress and anxiety associated with this news, it's important that we take time to do a thorough assessment and gather all information. You may be asking, isn't it risky if those high-risk contacts of the person who tested positive for COVID-19 are still attending school? Actually, the risk for further transmission of the virus by others who were in contact with the person who tested positive is reduced due to the infection prevention and control practices that are already in place at the school. This includes cohorting of students and staff, physical distancing, the use of personal protective equipment like masks, eye protection, frequent hand washing. Our priority is to be able to identify and notify the high-risk contacts as quickly as possible so they can isolate and go for testing. If your child or children are identified as a high-risk contact, you will be receiving notification in a number of ways: an emailed letter, a recorded telephone message, or a text message. The recorded message will sound like this.
This is an urgent message from Ottawa Public Health, OPH. Dear parents or guardians, an individual attending or working at school has tested positive for COVID-19 and a child in your household has been identified as a high-risk close contact.
I hope that this video has helped to explain the rather involved process of identifying and notifying high-risk contacts. This process does take time, and we appreciate your understanding and patience when there seems to be delays. Community safety and well-being is our top priority at Ottawa Public Health. For more information about COVID-19 in schools, please visit our website at ottawapublichealth.ca/schools-COVID-19. Thank you for your ongoing patience as we all learn to live with COVID in our community.